Good afternoon, everybody, and almost evening to everyone on the East Coast. My name is Monica Godfrey-Lehrer. I am a certified O&M specialist, as we like to call ourselves, comms. My sign name is Emmanuel M, going over the right side of my face. By education, I went to school for speech and audiology, and I also have a master's degree in blind rehabilitation with that certification in mobility. I have two distinct roles at Helen Keller. My title is a supervisor of 3 different departments, mobility, low vision, and also audiology. And I not only supervise, I do also continue to teach mobility as the needs arise. So in all my years of teaching, I've never stopped. It's been something that has always pushed me forward, my hand in the profession with the live instruction. We're going to be moving to the next slide. And this is, Monica, just for Olaya. The poll is up on the screen. I'm just going to ask for you to take that down so that our audience can see the PowerPoint. Okay, great. And it's back up. Let me just see if I could, maybe it's just up on my computer. There we go.
Is it still, is it gone?
There we go. It is gone.
Okay, thank you. I'm sorry about that. Thanks for letting me know.
So this is Monica. I've had the distinct honor of working for Helen Keller National Center, and our acronym is HKNC, for the past 21 years. There's a picture on this slide of our training building. We have a lovely 25-acre campus, and our mission is to enable each person who is deaf, blind, to live, work, and thrive in the community of his or her choice. Next slide, please. So Helen Keller National Center is the only national, comprehensive, and vocational rehabilitation program exclusively for youths and adults with combined vision and hearing loss. We are a residentially based program located on the North Shore of Long Island in Nassau County. And for those who live outside of New York, we are in the westernmost county of Long Island. Helen Keller provides vocational training and assistance to consumers in locating employment, housing, and community resources in the community of their choice. Next slide. Helen Keller serves communities in a variety of capacities. I always like to explain Helen Keller in terms of a machine. We are an enormous machine. Our headquarters is located on our New York campus. We have 2 community service programs where we are actively in communities serving in person, both in the New York metro area, as well as our new program in the Los Angeles, California area. Throughout each state, we do have direct contact from our regional representatives and our deafblind specialists. So we are an enormous company, and we cover the entire United States. And together, it's the only way we can make all of this happen. Next slide. So before we begin part of the meat of this webinar, I want to go over the presentation objectives. Next slide. And as we go to the next slide, we're going to do an interpreter switch. This is Monica. We're going to be spotlighting Angela as our interpreter. And this is Monica. Olaya, could you please allow Angela to have her video on?
Okay, she should.
Angela, you are now a co-host. You can turn your video on. This is Monica.
Is she
Angela
able
is
to?
not up on the screen yet. Are you able? Okay, so Angela's video is on. Olaya, are you able to spotlight her?
Yes, she should be spotlighted.
This is Monica. Olaya, you're on the screen. Okay, so I'm on the screen and Angela is lost in the abyss.
She's okay. It's Angela Pateris, correct?
Correct.
Okay.
And it should say, possibly her screen should say ASL interpreter, maybe.
That's not, her ASL interpreter is not showing up, but her name is, and
Okay, we're getting information from the audience that we can see Angela. So thank you, audience.
Okay.
You guys are awesome.
Thank you. Yes, thank you so much.
So these are the objectives of this presentation. One, I hope you all can acknowledge that virtual O&M assessment and instruction is evolving. I hope that you also understand that when you bring a community together, it has an enormous impact. That when we learn about the auditory and visual parts, that those breaks are essential for everyone, having auditory and visual breaks. I hope that you all gain knowledge about needed communication accommodations for deafblind consumers. That you understand that O&M assessments and goals are based on our foundational knowledge. That we all accept that there may be hard stops in virtual instruction, but limitless options for theory and practice. And last, I hope that we all can move forward, literally. Next slide. So as I designed this webinar, I really had to acknowledge that we all shared in this COVID-19 pandemic. So throughout my webinar, I'm going to talk about the timeline and how it related to Helen Keller. And that's something that as an audience, we all shared. I think we all went through this process in a similar fashion, possibly with different dates. So in mid-March, what was happening was that the US was shutting down. Helen Keller's in-person services were being put on hold. Our consumers returned home and our staff left the center. I don't think that we will ever forget Friday the 13th. And that has new meaning now. I think the old Halloween movies are out and it's been replaced by COVID-19. I think that's something that we all can share. But as everyone left, Helen Keller still had a mission to fulfill. Next slide. And I'm just going to pause.
Monica, this is Olaya.
Yeah.
I'm getting, some people can see Angela, some people cannot.
Okay.
So I'm not. Yeah.
Make sure she's spotlighted.
Yeah, because she's co-host. She has the ability to, and she is spotlighted on my end.
Okay, so Olaya, you're on the screen. I am not.
Oh, I don't need to be on the screen. That's
maybe
I'm
okay.
gonna remove
So someone is
spotlight
just saying,
from me.
unspotlight Alana. and
Mhm.
possibly that will help us see Angela. Well, isn't that clever? Thank you, audience.
Yes, thank you. And I don't know. Let's see. I'm not spotlighted. I don't see myself being spotlighted here. Oh, Lord. So people are still getting closed captioning, and that's good. But it's the whole spotlighting issue. So let me,
This is Monica. This is live. So you are seeing everything that we've all experienced.
thank you,
All these
Monica.
lovely challenges. We will
Yes.
get to our programming in just a moment.
Yep.
Okay, so someone is saying they can see, there's Angela. Yay! All right, welcome back.
Okay, we're good? All right.
Yes. So we are on slide number 11. Throughout the presentation, you will all enjoy some conversations I've had with some people from our agency to help us understand how we did this together. And there will be a spotlight on O&M, but it's really important to understand how we do things at Helen Keller, because if those things weren't in place, we couldn't do mobility. So in this next slide, I will be having a conversation with Dr. Susan Ruzenski. She is our acting CEO at Helen Keller Services. Her name sign is a manual S in the center of your chest. We will now go to the video of Sue and me. Next, I'd like to welcome Dr. Susan Ruzenski. We call her Sue. Welcome, Sue. Thank you so much.
Hello, Monica. Thanks for having me.
So, Sue, as we were at really that second week in March when COVID really hit our nation, at that time, you were our executive director at Helen Keller National Center. Could you help us understand what was going through your head as we were sending all of our consumers and our staff home?
Well, that was my immediate thought in terms of what was happening. There was so much uncertainty regarding what was the pandemic all about and how was this virus going to impact us. If you recall, New York was the epicenter at that time, and it was very, very serious. So my initial thought was people needed to be able to return home to their families and their loved ones. And living here on campus may not be the safest environment for anyone, whether it be the staff or the consumers that were here for training. So it was about making sure that people had ample time to return home before possibly the airlines were to shut down as well.
And it is, as an agency, wasn't it so fulfilling that we got all of our consumers home and all of our staff home safely without any incident? All of them were safe. And that's really a testament to your leadership and our entire team. When everyone got home and there was an odd stillness because we're so used to being together all the time, what were your initial priorities in fulfilling our larger mission?
So I think we all, we all realized the most important piece of this at that time was making sure people were safe and that they were doing okay. So thinking about those individuals who left here to return home, making sure that we connected with them to find out how they were doing. Did they have any needs when it came to food? I mean, at that time, it was difficult even to go to the supermarket and get a food supply. Were they in need of medical attention or mental health? How were they doing emotionally in handling all the stressors that came along with this? So I think, the idea of what can we do was really about just start communicating with people, just start reaching out through whatever means possible to check in and find out how others are doing. And then honestly, it was maybe several days where it was then becoming more about how can we still be relevant? How can we still be there to offer services? And trying to wrap our head around a way of doing that through a virtual platform or a variety of ways through technology. And knowing what it was like for us to try to gather information about COVID, I mean, it was information here, there, trying to pick up the facts. What do we need to do? What, you know, do we need to close? When do we need to close? What are the safety protocols when you're in the community, when you're not? And making sure that the individuals that we work with, that the community had that information. So that was our first starting point, was like, how can we get this information out to people who may not be able to access it through other means?
And then we did a really big pivot. We started peer learning groups, which I'm going to go into a little bit later in this webinar. And then we also provided virtual services in the form of assessments and then training. What surprised you most as we pivoted to these virtual services?
Well, it was fascinating to see right away how important it was. You know, how many people were interested in connecting through those peer learning groups, and knowing full well, you know, having the opportunity to connect with others and make meaning of this experience, and then to also, you know, focus on other things in a positive way through learning, you know, through sharing experiences and perspectives, was very, very important. I was surprised at how quickly we were able to get that moving and going. Not only the peer learning groups, which is really where we began, but then also looking at, well, okay, what are some options here for vocational rehabilitation training through a virtual platform, through distance learning? And we had talked about a number of areas in the past that we felt, you know, we could, for example, we were just experimenting through a pilot program around Braille, and how we could provide Braille instruction to individuals who may not be able to come here or live in areas where there are no Braille instructors available who can communicate. And that had been in progress, but we found that, thank goodness, we had begun those types of pilot projects, because then it became necessity. So necessity, you know, being the mother of invention. And also, you know, the biggest shift, I think, was people's own perspective about what's possible. If you had asked maybe, you know, someone in mobility even 6 months earlier, Monica, could we teach mobility, you know, through Zoom? I mean, yes, of course there are limits, but it would have taken you several, you might have paused and said, you know, I don't know what you're talking about.
Yes.
But, you know, the creativity was endless. You know, the way that people tailored their instruction, utilized different tools. I mean, videotaping people in the community and then debriefing on those, you know, travels out there. So many different areas where that occurred. I mean, finding and problem solving the technology for people to use in whatever works. You know, and just being able to tailor our goals. Having summer seminars and summer youth programs with groups of, you know, youth together going through a curriculum using virtual job shadowing. I mean, there's just so many different new ways that we discovered that will be with us now forever, because of course, you know, it's effective, and it's also in some cases efficient ways to provide training for people who can't drop everything and come to a center like this for training.
Absolutely. So many different surprises that came our way. Now let's just look to the future, Sue. What does the future look like for Helen Keller National Center, and most importantly, all the amazing consumers that we serve?
So, you know, in the immediate, I think we're going to just continue this journey. We're fortunate here in New York that we're able to offer face-to-face services, and also we continue with remote services. There are some individuals, of course, that are reluctant to meet with people, you know, in their homes or to come here to the center, which is fine. So we want to make sure that people are comfortable. I think that we'll continue in the immediate with our local services in that fashion. Our remote learning will just keep growing. I think that new programs are happening as we speak with a new college prep program. I mean, it's just, there's endless possibilities. And I think what's happened is it's connected people from all parts of the country that may have never had the opportunity to cross paths. So that's another really, great outcome of this. I think in the future, even when, and we do know that will happen, the day will come when we'll able to open our doors here on campus again and have face-to-face services and welcome people from around the country. But we'll have options. People can begin some of their training before they even come here using virtual means to do that. Maybe they prefer a hybrid, there's so many ways that we can, just imagine right now. So I think the sky's the limit, honestly.
Sue, I just love that you say that because, I always often say in mobility, without options, you're always stuck. And now, unfortunately, because of the pandemic, and also fortunately, we've been forced into now endless possibilities. And like you said, our future looks so bright. And, I'm so thankful that you joined us today because leadership is everything as we move forward. And knowing that we have a strong leader at the helm, helping to guide us, but also working together with us is really, really important. So I really appreciate your time today, Sue. Thank you so much.
My pleasure. My pleasure. Thank you very much.
And this is Monica. Next slide. So this is Monica. As Sue and I were discussing, Helen Keller made a huge pivot. And when we did that, we really had to look at what our priorities were. And they were twofold. Number one was to support the deafblind community through the creation of our peer learning groups. And then number two, we really needed to continue serving our consumers through virtual assessments and training. And I put on the slide my hand on my head with that emoji of like your eyes are bugging out because all of us supervisors were tasked with creating virtual assessments and virtual training before our staff came back. And I think this is where the audience takes a deep breath of remember when we did it. And we created those. And I will talk about how we did that a little bit later. But it's important for us to, as we go to the next slide, again, touch base with our timeline. So on April 6th is when we welcomed our staff back, but we welcomed them back in a remote capacity. On April 20th, we started our peer learning groups, which is quite an exciting day for us. So in our next slide, you guys are going to see a conversation with me and Laura Bench, who is also a comms. She is one of our regional reps, and we are going to discuss the peer learning groups. Next slide. And before we start this video, we are going to do an interpreter switch. So I'm going to ask the audience to have some patience. Here we go. And we're going to have Angela turn off her camera. Awesome. And we are ready. Everyone, we'd like to welcome Laura Bench. She's one of our regional representatives from the Rocky Mountain region. Welcome, Laura.
Hi, Monica. Thank you. Happy to be here.
Well, today in this segment, we're talking about our peer learning groups. And you were one of the first people to be tasked with collecting all the data of all of our participants. What was the initial intent for Helen Keller in creating the peer learning groups?
Well, when COVID-19 hit, it was like a world of uncertainty and isolation. And there was a lot of, response from the community of now what? And then speaking from the perspective of the regional rep, there were several individuals who had planned to go to HKNC for training, specifically for some of that socialization with other deafblind peers. And so that aspect, even when we started adjusting some of our service offerings to, you know, our training to online virtual training, that peer connection is really what we wanted to find a way to provide to the community. And there's also a lot of details with state contracts, what they can provide, what they can sponsor. And so looking into an opportunity to have peer support, peer learning, and most importantly, a free resource to the community, regardless of how their state is adapting to COVID-19, was really important. So that was the goal, is to give an opportunity for people to connect together and just keep learning, keep learning from other people's experiences, from HKNC staff, and just have that connection to information and resources.
And Laura, I mean, that's so great that we not only came up with this concept, but then we offered it really gratis to the community. But as you were collecting the data, when you were registering everyone for those initial groups, response from the deafblind community?
Well, there was a lot of buzz initially, because like I said, there was just this uncertainty in the air, a lot of anxiety related to how am I going to stay connected to people. So initially, there was very positive feedback, which I think was affirming to us. You know, Helen Keller National Center sometimes tries to identify and project what needs are, but whenever we actually have that affirmation from the community, it's really helpful to know, okay, we're in the right direction, or we can always adapt as needed. So the feedback was extremely helpful. Many people were responding to me with, thank you so much. These are exactly what I was looking for. And then some people gave feedback for additional concepts of like, oh, I see that you're providing a technology Q&A. I would love to have, you know, a technology course specific to Apple products or something like that. So we would get feedback for ideas as well, which helped expand the concepts of what we're going to offer with the peer learning groups. And then we also got feedback as the groups got started on what worked and what didn't work, which is really, really helpful as we were starting to design some of our virtual program offerings as well. So people would give, you know, their feedback as far as this communication was accessible for me, or, you know, we provided the peer learning groups on the Zoom platform, and some people said, I really prefer Facebook Messenger and I prefer written English. And so that helped guide how we provided accommodations and continue to adapt how we were reaching out to people. You know, one of the biggest changes I think that we were able to implement in the first session based on the feedback was providing communication facilitators for each of the individuals. So we had somebody from HKNC facilitating the actual dialogue, the questions, the Q&A, but having somebody assigned to each person's accessibility was so helpful. Whenever things would come up in the middle of the peer learning group, they knew exactly who to tell and how to ask, and the group wasn't stalled at all. It was just a very smooth response to that. And so sometimes we would have captionists involved, or sometimes we would just have somebody confirming throughout that it was successful. And so that was really a system that was established based on the participant feedback.
And as we went from session 1, and I think now we're, wrapping up session 4 and going into session 5, which is really amazing.
Yes.
What have been the benefits of Helen Keller offering these peer learning groups, not only to the community, but also to Helen Keller National Center?
So the benefits to HKNC have been pretty substantial because, like I had mentioned, the feedback we got really was the reason we were able to continue these sessions. It wouldn't have been successful without having that consistent communication with the participants and understanding what we can do to improve. And so by being able to have this opportunity to learn from the community, set us up for being able to offer virtual trainings as well and design contracts with states. And so if we hadn't had the opportunity to really figure out how to make something like this successful, then we wouldn't be able to keep moving forward in several capacities that we are. So that's been pretty substantial to our understanding of how to provide support to the deafblind community through virtual services. And then we also have had the opportunity to extend our outreach. There are many people in rural communities or for different reasons aren't able to travel to New York, but wanted to attend our CVRP, our Comprehensive Vocational Rehabilitation Program, but for one reason or another weren't able to travel. And so this has really extended how we're able to support the community, how we're able to connect with them, provide resources to those who maybe didn't have the opportunity to come to New York or didn't have the state sponsor to receive training. So that's been a huge benefit to us to learn how we can continue to provide support to the community regardless of the situation, regardless if there's a pandemic out there, which who would have thought, but that's something that we've had to adapt to. So that's been great. And then the feedback from the community has been very positive as far as their benefits and what they've learned. I think the biggest response that I've received is the benefit of connecting with individuals outside of their state. So, you know, it's a low incidence population. So sometimes finding people with similar experiences in the same age group with similar goals, that can be a challenge. And this has really provided the opportunity for people in Alaska to connect with people in Texas. And I think that that's something that, you know, we take advantage or we take for granted. In New York, we see, oh, all these people have come together, but recognizing that, you know, there are more people out there who are really wanting to connect with others. And these peer learning groups has allowed that opportunity.
You know, Laura, I just think like the peer learning groups have been just such a gift to the community. And I really appreciate you coming and sharing just a little bit about them. And Laura, I just tell the audience, if they know of a deafblind consumer of theirs, or if we have a deafblind individual who's actually watching this webinar, how can they find this information on our website to join a peer learning group?
Oh, sure. So that's very easy. You just go to hknc.org. And when you get to the home page, there is a bar on the side of the, you know, the left-hand side of the main landing page. And it just suggests, you know, new topics of what's happening with HKNC. You can scan on that and find the peer learning groups. So it's the very first thing you'll come across on that landing page. And then it'll take you to a list of the different peer learning groups that are available. You had mentioned different sessions. So we actually have descriptions for all of the peer learning groups that we have offered in the past. Not all of those groups are going to be offered every single session. Often we're doing things by popularity. So there might be the technology, you know, group offered every session, but the banking and budgeting one is every other session or something like that. So if a session is full, or if it's not offered, or if a peer learning group is full, or it's not offered during the session that somebody is looking for, they can easily still contact our admissions department and ask to be put on the waiting list, and they will receive priority for when the next peer learning group of that topic is offered. And then you can always contact your regional rep if you're not sure. So if you're having trouble finding it, the regional rep can send you information directly to you with all of the same information that you would find on the website. So it's pretty easy to get on there. I would also strongly encourage people, if they have an idea for a peer learning group, to share that with your regional representative, because that's how we grow and that's how we learn what the interests are of the community, is hearing that feedback, hearing the ideas. So I would say, of course, you can look at what we're already offering, but please feel comfortable reaching out with ideas and, you know, brainstorming with your regional rep.
Laura, thank you so much for joining us today. And I have to concur, like, if you are if you're interested in those peer learning groups, put your name in for every single group that you would like to join. Because I know like our mobility group was so popular the first round, and then there were so many offerings that people jumped into other content.
Right.
But they were so great with putting their names down, and our group keeps growing and growing and growing. We're starting a new session very soon. So it's very exciting. And thank you so much for helping us understand the benefits of these groups, and take care.
Of course. Thank you for having me. And I look forward to people, at least in the Rocky Mountain region where I am. I look forward to hearing of people wanting to join these groups and creating new ideas. So thank you.
Thank you again. So this is Monica. Next slide. So before we delve into the challenges, I just want to share with the audience about the peer learning groups that I created with my cohort of colleagues in low vision, audiology, and at the time I also oversaw our creative arts department. Our first peer learning group for mobility was created to really support travelers through COVID. And it was all about looking at yourself as a full person. You know, are you ready to travel visually, auditorily, mentally, and emotionally? And we really looked at every aspect of preparedness. And it was such a helpful group to be able to share their struggles. We all shared openly as staff. So all of my mobility specialists were on the call, creative art instructors, a low vision specialist, and also our audiologist. And we found that we all supported each other. We could be open and honest. And as we said today, we all found a way to move forward, whether if it was standing still or being brave enough to leave the home. That was very successful. And on an agency note, we were able to turn a free service also into a billable service, where we also could provide this in a different area of the country as a billable service. So this is something that I would encourage all of you, if you haven't started doing something like this, consider this, because each person within the deafblind community that has joined these peer learning groups, this may be the only opportunity to get to meet each other until we get to see each other in person again. And it's a great way to bring a community together. We're now offering a regular mobility support group, and I'm also finding the same thing, that travelers are supporting each other. So just a word of encouragement to the audience today. The challenges that we faced in providing virtual services. We all began our Zoom relationship. And I think that's something that we all share. We're all experiencing that today, that there's always technical glitches. But before we talk about the technical glitches, let's talk about the patience that's needed. And for us who serve the deafblind community, and for those who are members of the deafblind community, there's also deafblind time. And we're very grateful for that, with big smiles on our faces. When we go into technical glitches, you know, especially when it comes to Zoom, we were all having moments of, well, where's the link? What's an ID? What do you mean I have to enter in a password? Also, what's a chat box and how do we use it? Oh, wait, don't use the chat box. Or come on, add your comments like today. The big question for us was to spotlight or pin an interpreter. And let me clarify for the audience. When you spotlight people like myself and my interpreter, we're on the screen for the entire audience to view. When you pin someone, that's your individual choice. So if you're in a meeting, you can pin someone where you can have a better view of them. So it was really important for us to figure out, do we spotlight someone or do we pin them? And I think we have it down now. The other thing that we really needed as a center who values accessibility was to make sure that we all had backdrops and lighting. Backdrops that contrasted to our skin color. If you all know, I do have a darker background because I do have light skin. For our staff members with darker skin colors, they need a lighter background because contrast is everything. And it's really important for your consumers to be able to see you on the screen. Lighting is everything. It really can enhance you or it can make you invisible. So we're still working on the lighting. And I think that's something that everyone is working on now. But especially, and I don't have my blue light blocker glasses on right now, but if you're going to wear glasses and you're doing a live like this, make sure that the light does not reflect in your glasses. That's a key point that we learned. And then there were storms. In the middle of our summer programs, we had the hurricanes rolling up the East Coast, and we had participants from the West Coast as far as Hawaii, all the way to the East Coast. And we kept our live stream going every single day on time. And I'm just going to share a funny story very quickly. There was a moment where I was running one of the youth programs and we lost our internet. A lot of the East Coast states lost the internet, but I said, aha, I do have cellular data. And so I ran that program for 2 days in the parking lot of a Starbucks. And we went live and we didn't miss a beat. And everybody, including our participants from way west, joined, and it was super successful. So there's always a way. And the thing that brings a smile to my face is that can we never have enough batteries or cords to charge our devices? That was always a challenge. And it's probably something that everyone is still struggling with today, especially with all of us being home-based. Next slide. So at Helen Keller, I always say to people who want to know more about Helen Keller, I always say what sets us apart from other blind rehabilitation and vocational rehab centers around the country. There are two things. And yes, we will be switching interpreters very soon. What we do best is we ensure that each individual that comes into our program has the communication that fits their individual needs. And we also have an in-house audiologist, and we will get to that. Looking at visual needs, you always want to ask yourself and the consumer, can you see the screen? How do you access things visually? Where are all the buttons around the screen of the device that you are using? Because every single device has buttons in a different place. If you are accessing everything with Audition, are your devices working? Do you need assistance? We've had a lot of luck with having our audiologist on with consumers before they start classes, before they join a group, to make sure that they can hear and have access to sessions. For those participants who were always using textual interpretation, did they have a family member or a friend who could provide that communication facilitation? If they couldn't, would they be able to access some kind of typing support? That could be through email, Facebook Messenger, and we found Google Docs to be extraordinary because we could have a typing team on there live. And also the use of interpreters like we're using today. How many do we need? And a backup is always necessary. For Catherine, we're going to skip the next slide because it's a little bit redundant, which is slide 18. We're going to move to slide 19 and do an interpreter switch.
Hey, Monica, this is
Yes.
Alaya. The sound that people hear, that whooshing sound, is just indicating that we're moving from one slide to the other. I just wanted to let people know that.
This is Monica. Thank you. There is no whipping going on anywhere.
No.
So this is Monica. I think, as we go into this next video, I want everyone to understand that communication and patience go hand in hand, and laughter is so essential. You know, as we were running and continue to run all of our peer learning groups, there's one thing that is so common with every single group. The group members and the deafblind community is a rainbow of access, meaning communication access. And everyone in a peer learning group accesses communication very differently, as we all do. But what is so amazing to witness is that everybody in these groups are so respectful of each other's communication preferences and time needed to get all of the information. And that is just extraordinary. Everyone has embraced each other's communication and has supported it, just like you guys are doing right now in this webinar. You guys are letting us know what's going on. You can't access something. You need to see the interpreter. This is why we are community. So let's go on to the next piece. We're going to be going into a live chat with Maricar Marquez. She is the supervisor of our independent living department. Her name sign is an M touching below the right and left shoulders on the chest. We're going to just pause for a minute as we set up our live interpreting. And I just realized, as this is live, that I put Angela on the screen, and Angela will be doing our voicing for this. So I'm so sorry, Alana, but we are going to switch back to Alana. And then we are going to be spotlighting Maricar.
Okay, I'm working on it. Okay, there she is there. At spotlight.
And this will just take a moment.
Is she spotlighted? Can you see her?
Oh, this is Monica. Yep. Let me see here. I do not see Maricar. I think she
Hi,
should
everybody.
Let's see.
I see her.
Okay. Is there a way, Olaya, to get Maricar up on the full screen? Is it possible to spotlight the three of us up on the full screen?
Let's see. Did that work? No. How about that?
It is you.
It's
Now
me?
it's me. Now it's me.
Catherine, since you are sharing your screen, can you do swap video and shared screen? Because I think you want Maricar, like you want the PowerPoint to be minimized and your video to be maximized, correct?
This is Monica, correct. And Amy Parker is telling us that the PowerPoint is gone. All right, we are all up on the screen. Hello, Maricar. Thank you so much for joining us live today. I am so appreciative of your time.
Hi there. Hi, everybody.
And I just want to let the audience know that Maricar is at Helen Keller National Center right now. She is receiving tactual communication from an interpreter. So Maricar,
I am.
prior to COVID-19 and all of us going into a remote working capacity, what were your primary modes of communication, both expressively and receptively?
Thank you, Monica. I appreciate it. Prior to COVID-19, well, let's just go way back. I was born deaf, and I used expressive American Sign Language throughout my life. And I was able to access information visually. But as my vision began to deteriorate, I do have Usher syndrome. My communication access mode changed to tactile communication, which is full hand over hand, where I am able to receive visual American Sign Language tactually. I do use a combination of haptics to receive visual and environmental information as well. As my vision deteriorated, I was able to read print, but have since become a Braille user. And I do use a refreshable Braille display for computers and telephony. And that's how I access the internet. My role as the supervisor of the independent living department at HKNC, I'm able to participate in those face-to-face sessions using a tactile American Sign Language interpreter and a voice interpreter, similarly to what you see here. Many of my staff all do use no sign language, so I'm able to communicate with them directly. When I'm working with consumers who are deafblind, we do communicate in sign language, but it also depends on the individual as terms of what their communication is. Prior to
So Maricar, this is Monica. So since working in a remote capacity, how has your individual access to communication changed?
Well, COVID-19 has had a tremendous impact and has dramatically changed my access to the world at large and to people. You know, first and foremost, staying home and working from home. My husband and I have very different roles at HKNC. We needed to make sure that we both had internet access. So those first few weeks, a lot of it happened through texting and email and trying to reach out to my co-supervisors as well. Zoom meetings were challenging at the beginning. We had regional rep meetings. And so for me to access those via Zoom as a tactile sign language user was very challenging. We had to figure out how I could do that with a refreshable Braille display and access language. I felt very disconnected from the world, to be honest. You know, this was a world where I relied on touch, and touch was now forbidden. So how do I do that as a tactual person? So I first had to really come to terms with fear, honestly, how I could access everything through Braille. And could I learn the variety of platforms that were available? So there was a hard learning curve in terms of accessing it, and not everything is accessible via Braille. We tried a number of different strategies, and I was involved in a number of meetings to try and access and to level that playing field. And so it was a lot of trial and error. And I remember, you know, having my laptop on, but then my camera wasn't on, or that my camera was facing my lap, not facing my face. And how would I be able to adjust that? So we had to really get creative. And a lot of our communication was via email, a person typing to me, sort of letting me know what adjustments I needed to make. I used my Fitbit so that it would alert me when an email came in, so that I would go to the display and check that email to make sure that I was accessible. I needed to make sure that where I was signing was visible. And at the same time, be able to get that information via Braille that people were trying to communicate with me. And to do that 24/7 is quite taxing. My primary language is a visual sign language, not Braille. So it took time and it took patience and it took mutual respect of everybody in those meetings to recognize how far behind I was and allow me the time to catch up as conversations were flowing. So that was quite a challenge. Coupled with, you know, not having access to tactile communication, which was my mainstay, and how to set up that communication.
This is Monica. It's hard not to become emotional with how you are describing everything that you went through, and knowing that a good majority of people that we serve went through this exact thing with very little to almost no resources. How has this impacted you as a professional, and how you relate to your cohort, meaning all of us as supervisors, but then also all the consumers that you serve?
Initially access was limited to almost none, but I continued to work. I continued, supervising the few people in my department. The instructors themselves, they were able to Zoom with one another and facilitate those peer learning groups that you had mentioned. But myself supervising them and being able to communicate with them and to communicate with my consumers was quite challenging. I would be able to meet with people one-on-one typically, but these are a variety of people in these meetings simultaneously. And my communication typically happens in one-on-one. So it would be through chat, through email. It's much more effective for me one-on-one versus being in a group in a virtual setting. And that was really challenging initially because I felt very much out of the loop. And I know that everybody was incredibly respectful. And I found that I was not as involved as I had been, honestly. And I really tried my best to be involved. And I was able to speak to a number of people, of course, directly, as I said, one-on-one, but that was through email and through Braille. Through sign language, my native language, that was almost non-existent. And so I think that, honestly, I felt very isolated. It was very frustrating. And to come into a Zoom meeting, with 30 or 40 staff people was untenable to keep up with that kind of banter and chatter. And even just to me say hello, I couldn't see your faces, 40 little windows. It was challenging. And I did have, some information, but I did not have environmental information. I did not know who was speaking. I was at home.
This is Monica. I think it's so hard, being a colleague of yours. I just have to say, you are just extraordinary. The resilience that you have demonstrated all of us has been quite amazing. And I'm sorry I'm doing this to you live, but you really are amazing. And you're really someone to applaud and hold tight, because you show us all that everything is possible. And for that, I thank you. So my next question is, at times you must wear a mask, as you are right now, when you're receiving textual American Sign Language. How does wearing a mask impact your expressive communication for the deafblind consumer?
Expressively, I am able to communicate as I would normally, but the person receiving my communication, they can't really see my full facial expression. Only half of my face is visible. So you can't tell if I'm smiling, if I'm laughing. If you're able to hear, you're able to, if we're in the same space. But for a deafblind person, how do they really know my affect? They can't. So I have to be more expressive and really tell you that I'm laughing. Or I might use a haptic if we're together face to face to express that I'm laughing. so that the deafblind person is able to receive that information. So for somebody with low vision, I might use a haptic cue, whereas before they could actually see it. It's very challenging for those watching me, honestly, because they cannot see the full affect of my facial expression.
So in closing, what have you learned through these communication challenges? And what advice do you have for other professionals in the field of O&M who may be serving deafblind individuals?
Based on my experience as a professional and a consumer, I see both sides of the fence. As a consumer, I understand your challenges. I've been through them myself. And I think it's critical that professionals who work with deafblind individuals exude patience and be mindful of the challenges that people are facing. And always have that be ever present in the back of your mind. Think about what the world is like for people who are deafblind now. And think about their access and how there is a lag in the communication and information that they're getting, let alone the actual lag of the platforms that we're using and that delay. Think about how technology can be used and be creative to meet the needs of the individual, and that those might be different. For example, as I mentioned, my ability to use a Fitbit that just told me that an email was coming in so that I knew that I needed to attend to something. You have to be creative, because I will honestly say that nothing is 100% accessible right now. So please be patient. Please do not rush. Please be mindful of turn taking. And please be inclusive. And remember to add that environmental and visual information, because those of us that use a haptic provider don't have that now. And by doing all of those things, we as deafblind people will become more empowered and involved and embrace that.
This is Monica. Thank you. I think those words of advice is something that we all can take to heart, that patience is needed with every single person that you work with and that you serve. We are running just slightly ahead of schedule here, which is fantastic. We're just going to pause for a second to see if anyone from the audience has any questions for Maricar specifically. And if we don't, we will move forward. Just reading from the chat, I just want to read from Amy Parker. She's saying, thank you for sharing how challenging it is to learn all of these mechanisms and platforms at one time. How smart to use your Fitbit. You are showing the humanity and beauty of trusting communication that is resilient beyond the pandemic, but especially essential right now. And Amanda is one of our participants, and she said, you inspire me. So right now, we don't have any questions from our audience, which is totally fine. But if you do have questions for Maricar in the future, we're more than happy to share her email address because she is always a wealth of knowledge when it comes to communication access for every single one of us here. Reading one last thing in the chat box here from Marilyn Schrader, who is one of our regional reps at Helen Keller. She said, this certainly emphasizes the need for connections in any way for our community. Thank you so much, Maricar. Wonderful session. Hello, everyone. Please contact anyone from HKNC through our website, and our contacts are listed on the site below. Thank you so much, and beautiful job, Monica.
1 second, Monica, there's a Matthew Bullen has a hand up. And I'm not
Okay.
sure if that's a question for Maricar or for later. And Jennifer also has her hand up.
This is Monica. I believe the gentleman had his hand up raised and everyone has lowered
Now
their.
yep, no more hands are up. Okay, I'm sorry.
You guys are sneaky. So this is Monica. Thank you so much, Maricar, and thank you, Tom, who is Maricar's tactual interpreter for today. Thank you both so much. I appreciate your time.
Thank you.
And we are going to go to the next slide. And we are also going to change interpreters.
So Catherine, there we go. And let me fix this. There we go. I think are we good now with interpreter?
Yep, this is
View.
Monica.
Yay.
The screen looks great. So the next challenge that we faced was all about our visual and auditory struggles, really, that all of our consumers were faced with, and our staff were faced with the same challenges. In the next slide, you're going to be watching or hearing a conversation between me and Melita Niles Johnson. She is our low vision therapist, and her name sign is Manual M, signing Cookie. Also joining our conversation is Carol Hamer, our audiologist, and her name sign is Emmanuel C, signing Audiology. I'd like to welcome Melita Niles Johnson, who is our low vision therapist, as well as Carol Hamer, our audiologist. Welcome, ladies. Thank you so much for joining us today.
You're welcome. Thank you, Monica.
We are talking about the visual and auditory struggles all of our consumers have been facing since we've been providing classes in a remote capacity.
Mm-hmm.
If you could just help us understand, how real is visual and auditory fatigue? And Melita, we'll have you start.
Okay. Visual fatigue is very real. Very, very, very much so, in that often at the end of the day, the students are complaining of headaches, blurred vision, and mostly is headache, and they can't do anything else for the rest of the day. They go into shutdown mode and go into
This is Monica. We're just Melita Niles Johnson, who is our low vision therapist, as well as Carol Hamer, our audiologist. Welcome, ladies. Thank you so much for joining us today.
You're welcome. Thank you, Monica.
We are talking about the visual and auditory struggles all of our consumers have been facing since we've been providing classes in a remote capacity.
Mm-hmm.
If you could just help us understand, how real is visual and auditory fatigue? And Melita, we'll have you start.
Okay. Visual fatigue is very real. Very, very, very much so, in that often at the end of the day, the students are complaining of headaches, blurred vision, and mostly is headache, and they can't do anything else for the rest of the day. They go into shutdown mode and go into a dark room for the rest of the evening.
And Carol?
And with auditory, it's really the same response that the body's giving. The ears and the brain. Let's remember, it's not just the ears that are listening, it's the brain, it's the entire person is listening. And at the end of the day, people often feel like they have to, if they use hearing aids, remove those hearing aids to give their brains a chance to rest. If they use other devices like cochlear implants or other implantable devices, they might also remove them, because, you know, we have all heard how, for the general public, Zoom can be fatiguing. And then when you add the components of a dual sensory loss, it's even more fatiguing. So we really have to be very mindful of this so that we're not introducing more stress into someone's life.
And just keeping these things in mind, you know, how all systems really work together. So really our whole body is becoming fatigued. But if we narrow in on the vision and the auditory piece, how do we mitigate that as we go along with our instructional duties during the day?
Well, with the vision piece, they need to take breaks often. You know, one of the things that that we have been recommending is that they take every 20 minutes, they take at least a 10-minute break from whatever visual input that they're receiving, whether it's on the computer, whether it's on their CCTV, their television, whatever it is. Every 20 minutes, take a 10-minute break, not to go and read a book or anything of the sort, but to just either rest your eyes by closing them or by actually going outside and looking far, you know, just going for a walk, just to relax the eyes altogether. That way, the eyes will then be able to recharge itself and not be under stress for such an intense period of time, an extended period of time.
And, you know, with auditory fatigue and with taking breaks, the same is true. You don't want to take a break and then make a phone call or do something that's going to put more pressure, you know, more strain on your brain. You want to really just disconnect, power down temporarily, give yourself a chance to just be silent, and the silence can be visual and auditory.
Mm-hmm.
This is Monica. I think probably as professionals, this is really good advice for all of us to take, that when we encourage our students to take a break, whether we're, you know, instructing children or consumers that are adults, we probably all need to power down. And that doesn't mean, oh, I have like a minute, I can hop on my email or I can send a quick text. Like, we all need that visual and auditory break. So such great reminders for us to remember. Now, both of you, obviously, we all work in a center-based facility at Helen Keller National Center. How have you both been serving in a remote capacity since we've been doing that? Melita?
Well, it was a journey to get here. First, before I could actually serve on a remote capacity, I had to figure me out in terms of how would I be accessible to the individuals that I'm serving, because I'm serving individuals that are low vision. And we always stress that they have their background be contrasted to the object of their regard. So here it is, the object of their regard is dark in complexion. So now I had to make sure that they would be able to have access to me. So that meant that I had to research what would be the best lighting and put that into play so that the students will be able to have access to me and then be able to share with them. Because most of my students are signers and not, you know, they don't have not all of them have the capacity to hear what I'm saying. So I have to use sign language to communicate with them. So they have to be able to read the signs and be able to see my hand movements. So if they didn't have access to that, then I would be of no use to them. They would not be able to, that would be more frustrating, and not just frustrating, but also visually taxing, because they would be straining themselves to see what they're not able to see. So they are working double time to have access to what is not accessible to them. So I had to first figure the lighting out. And once I was comfortable, that yes, they would be able to receive the information that I'm giving to them visually, then we were able to move forward. So with that in play, I'm now able to have conversation with our students regarding the type of lighting that they have, they could use, regarding eye strain, double vision, watery eyes, their doctor's visit, when to schedule it, when not to schedule, what questions to ask, what questions not to ask. So we get to have conversation, about pertinent things that are happening right now to them in their lives, and how to make sure that their vision is not as stressed out. That's the best way I could put it right now.
Research, so helpful. Thank you for explaining that.
Not a problem.
Carroll, how have you been serving in a remote capacity?
Like Melita, it's been a journey. And if you had told me that I would be serving remotely, I wouldn't have fully imagined all that it can actually encompass and all that it can actually accomplish. Because first of all, you see I've got a Black background, and I want to say for hearing, for listening, lighting is also very important. So everything that Melita has said regarding consumers using their vision comes into play when we're talking about listening. Because if you have any residual vision that you feel you can use to get information by looking at the person speaking with you, you're going to strain your eyes to get as much information as you can. That's just the way you do things. You put all of your body into listening, so that the lighting really is very important. But the other thing is educating consumers about the best way that they can use their residual hearing for distance communication. And, this is not only important for our consumers, but for mental health, it's important for everybody. We all need to stay connected, and some of our consumers are some of the most vulnerable and isolated individuals. And so being able to connect using your hearing, if you have residual hearing, is about educating how you can do that. Many hearing aids now can Bluetooth with a cell phone without any other device being involved. On the other hand, most any hearing aid, if it has a telecoil, can connect with a cell phone through a neck loop. So knowing how to accomplish these listening tasks, and knowing what to ask their audiologists, because they might not have been educated at this point regarding all of these different aspects of connecting. Not all audiologists are as comfortable with telecoil and other assistive listening devices. So it's important that I am able to speak with the consumers, see what they need, and make recommendations based on how they interact with their environment and with those around them.
From both of you, it's what we're understanding is that we all now, because we're in a remote capacity, it's less of the hurry up, we're following a schedule, and more time to really understand what their unique challenges are, and then really kind of suss out how to address them. And what better way to do it than in a remote capacity, when they're actually having to to use all their faculties to pay attention and learn. So really great things to keep in mind. Now, for both of you as our audience or all stakeholders within the O&M profession, what pieces of advice do you each have for them as they're providing instruction in a remote capacity? What should they remember regarding vision and hearing? Melita?
Well, with vision, definitely give the break time. Make sure that they are utilizing their devices, their low vision aids. Most often than not, a student may choose to not wear their glasses, and it's for a reason. Either it's doing the job that it needs to do or it's not. And sometimes it's just because of appearances also. The students may choose not to put on their yellow tints because they're yellow, is not the norm. But encourage them to use their devices, because that will give them the vision to do the best job that they possibly can do with the vision that they have remaining. And we want to encourage them and let them know that the success in their mobility, being able to get around or navigate from one environment to another environment, if that is dependent on them using their residual vision with the best corrective device that they are able to use, then that's success. That's what you want. Use the tools that you have available to you. And we as their instructors, we need to motivate them and encourage them and let them know that what they're doing is awesome, so that they will feel comfortable using the devices, and not feel that, my friends who they don't have to use this. We want to really encourage them, motivate them, and let them know that what they're doing is awesome and is courageous. And you want them to be as independent as possible. And in using their devices, that will bring them success.
Absolutely. I completely agree. And Carroll, last words of advice to the mobility community?
With consumers who use hearing aids, there are frequently times where they don't know what their settings are on their hearing aids. It's really important to make sure that the consumer knows how to access the different programs on the hearing aids if they have them, and that they know when to use particular programs. And for some consumers, they might have a specific mobility program. The other thing is, regardless of what type of hearing device someone is using, be it hearing aid, cochlear implant, bone-anchored hearing appliance, how long has that individual been using that device or those devices? What does the individual's hearing look like on an audiogram? Get as much information as you can and ask questions of the individual and of the audiologist if the audiologist is available, about the best way to use the person's residual hearing, and just get to know their needs, their hearing needs in relation to mobility, because everybody is going to be different. And we all know some people can use their hearing for safely crossing a street and others cannot. And that's where communication cards come in. So have a complete picture of the individual.
Go ahead, Melita.
Just to tag on to what Carroll just said about having a complete picture of the individual that you're working with. So that means also making sure that you have access to their reports, having read that, so that you would have a better understanding, a full understanding of what this person is all about, not just in reference to their mobility, their ability to use the cane, but how does it impact, how does their vision impact? Is it their visual field? Is it narrow? Is it open? How much visual field do they have remaining? So that you want that information, and not from just from the patient themselves or from their report from their state, but actually a doctor's report where that was performed by the doctor, so that you will know exactly what the doctor is saying, and you would be able to interpret that and incorporate that into your mobility lessons. You know, if you know that they're night vision, and you will be able to observe out also, but having the medical information in front of you so that you have a visual, so that you have an understanding of who this person is. And then as you're observing them in the process of working or, you know, navigating their environment or in the conversation that they're having, you will then better get a full picture of what they're saying, and not just in isolation of what the patient just said by themselves, but what the medical record is saying, what they're saying, meld them together, and then you will get a better picture of who they are and what your assessment based on what you have observed and heard from them.
This is Monica. I want to thank both of you for helping us understand really all about the needs of all of our consumers that we serve at Helen Keller regarding visual fatigue, auditory fatigue, also things to keep in mind. And most importantly, you know, everywhere you work, you always have a team of professionals that you work with. We're so fortunate to have both low vision services and audiological services, because those are always the foundation, you know, before we get started in mobility. Understanding those and is just so important. So I want to thank you both for joining today.
Thanks, Monica. It's been a pleasure.
This is Monica. We'll go to the next slide and change interpreters. So this is Monica. We're moving on to O&M. That was all the foundation. This is before we actually can do our job in mobility. We have to understand everything else. Next slide. So we're doing a timeline check. On May 1st, HKNC resumed programming in a remote capacity. And the key to us shifting in mobility was acknowledging our foundation. Our foundation in which we were educated in was strong, and that would help us pivot. Next slide. We really had to acknowledge that we were going to be assessing people, but also in a consultative role, because our observational data is very critical to what we do in orientation and mobility, and nothing will replace that kind of data. Self-reporting, as we all know from our consumers, is often inaccurate, and that we also need to understand the risk we take on as professionals, the risk of agencies, and also the individual risk of each traveler. Next slide. So all of us supervisors were tasked with writing assessments that were going to be handled in a virtual capacity. In mobility, what we did is we wrote an assessment in an interview style format. We went from soup to nuts, from pre-cane skills all the way to public transportation. Each category had many questions about how that individual traveled within each skill area, but also asked at the end of each skill category to demonstrate some of these skills live through the help of someone from their support team. The support team could have been a family member, a fellow professional that they had been working with, possibly a TVI, an O&M instructor, maybe even a rehabilitation teacher. We always cautioned the instructor that before we asked 4 videos from the consumer that we kind of assess the risk in obtaining those videos, because we knew it was an untrained eye who would be gathering that video data that we needed. And what we found was that all of our consumers were really in step with us when it came to risk assessment. They often set the pace. They often said, this is where I stop with the gathering of information, and we stopped at that point. At the end of each assessment category, we were able to note training goals and also concerns that were apparent to us through that interview style format. We're going to go to the next slide. At the beginning of the pandemic, we all received a letter from ACVREP, our certification body, and they helped us really remember principle number 3.7. And it goes like this: the comms will consider the safety and the best interest of the client, impact on team members, ethical implications of the method based on ACVREP standards, consultation with relevant professionals, and jurisdiction regulations. We really needed to understand all of those ethical things that we had to adhere to. Next slide. Now, Helen Keller National Center is a place where everyone comes. I work at a center-based place where we're all together all the time. Part of our staff includes a medical staff that is there on campus with us. What we understood in mobility was that it was so critical for us, and I think the field can relate to this, that a full case review was needed to better understand who we are serving. So there was a need to understand a medical diagnosis or medical diagnoses. What was the visual etiology as well as the auditory etiology? Also, how stable were they? Was there a mental health or emotional health? Was that being compromised? For us, we always feel that when we serve the full individual, we're able to work better with them. And we also feel that most of our consumers are very transparent about that. So we move to the next slide. We are reminded of several things from ACVREP. Number 1, be methodical in your risk assessment. If you deem the risk too great, then suspend the session or the program. And we've done that very successfully in our mobility department at Helen Keller. Often in those situations, we have passed the baton to the local mobility instructor, and we have worked with them live with the consumer. It's been very, very successful. Number 2, make and document your risk assessment and conditional recommendations about the consumer and or the need for additional supervisory support. It is critical beyond imagination that you as a supervisor, and especially me in my role, to maintain constant communication with my instructors to understand the challenges that they are facing in a remote capacity, as well as how they are serving each consumer and understanding where those risks lie. And last, evaluate instructional strategies for teleservices. Be creative. I think that's a thread that we're hearing through every single person's presentation, is that creativity is necessary for all of us. We found that the hard stops in our instruction were street crossings and also public transportation. But that doesn't mean that the theory and the practice can't continue. All of those steps leading up to a street crossing can be done in a format such as this. Public transportation, there's so many ways to talk about that in class, from applications to applying for paratransit and reduced fare. You can also look into different kinds of GPS services. The possibilities are endless, and we've had so much fun, especially doing virtual trips using Google Earth and possibly virtual trips that are available on different websites. It's been very, very successful, and the consumers have really enjoyed the experience. Our next video chat today I have to say it's probably one of the most important of this session. It's with Peter Cohen, who is one of our senior mobility instructors at Helen Keller. His name sign is Emmanuel P, followed by Emmanuel C. He will be chatting with his consumer, Cindy Carroll. She is a consumer of ours at Helen Keller, and her name sign is Emmanuel C over the heart. Let's welcome Cindy Carroll, who is a consumer of Helen Keller National Center, and one of our senior mobility instructors, Peter Cohen. Welcome to you both. I really, really appreciate you joining us today. So Peter, you and Cindy have worked together in a remote capacity, and you've been providing her with orientation and mobility services. And Cindy has been a new consumer of ours receiving the services. Peter, I'd like to start with you. When Helen Keller began remote services, what was your gut reaction that in mobility, we were going to become remote teachers? What did you think?
This is Peter speaking. I thought, I didn't really know how exactly we were going to do that, because mobility is being mobile. And this was not being mobile, sitting in front of a computer, giving instruction, when usually, as everybody knows in our profession, we're with our student and we're out in the community walking around, either in their home, their neighborhood, or their community. So I was very curious how it was going to go.
And this is Monica. Cindy, what were your thoughts? I mean, you applied to receive services from Helen Keller National Center. And I know in the past you've received mobility from an instructor that you've been with, but now you were going to receive services like on a camera. What was your gut reaction?
My first reaction to hearing that HKNC was not going to provide in-person training was disappointment. I thought that virtual mobility training would be impossible, but at the same time, I was hopeful because I thought by working together, I would at least be able to get some very useful information and understand mobility a little deeper. I thought in-person training would be a lot clearer and would be important for building tools I could use every day. I had only had 2 mobility classes previously, so my training was very minimal. Peter has given me extensive training and has really helped me a lot, so I think learning virtually wound up being a benefit.
You know, Cindy, if you came to Helen Keller, and Peter, if you were working with Cindy at Helen Keller, you guys would be communicating via American Sign Language, visual American Sign Language together. And now you guys were confronted with a virtual format. How did the two of you set up communication so that it was optimal, that you guys could be successful? Peter?
This is Peter speaking. Ordinarily, I would not use an interpreter on campus working with a student who's a signer, because I would sign with them. But in this case, because I'm doing an assessment and then providing instruction, I have to take a lot of notes, and just signing and looking up and looking down and writing would have been really time consuming and very difficult. So what we did ultimately use was Sorensen, and I was able to download the Wavelo app. And in that way, on my iPad, we were able to communicate with an interpreter, but it was just the 3 of us on the screen. It was Cindy, the interpreter, and me. And it worked out really well, better than I thought, because sometimes if you get an interpreter on Sorensen, that's not an HKNC interpreter, they don't always understand the terminology. And it would have been very difficult for me to get a good idea of what Cindy was understanding or not understanding if I was just on the phone going through a Sorensen operator. But the fact that I could see her face and I could read her expressions and I could see her nod her head when she understood, or maybe she had a look on her face where she didn't quite understand it, that was very, very helpful. And a lot of times I noticed some of the interpreters, when they would sign to her something that I would say that had something really just to do with mobility, if the interpreter didn't quite understand it, I could see the interpreter not understanding it. So I was able to rephrase it.
And this is Monica. You know, Cindy, I mean, what did you think of the communication system between you and Peter? Was it successful? Did you feel that the two of you were able to understand each other, to have productive classes?
Yes. Zoom was very helpful, even though we struggled to connect with each other the first time we tried it. Peter did help me troubleshoot a little bit, and then it worked. Using Wave Hello also helped. We used TeamViewer too, which was also very helpful because I was able to watch videos and Peter was able to see what I was seeing. Peter was able to see what my environment looked like because on the screen, it looks very different than in person. After we viewed the videos, we would chat on the video phone using Wave Hello. Sometimes it was hard with the schedule to get an interpreter, and the only thing that was available right away was Wave Hello, so that worked the best for us.
This is Catherine.
This is Monica. We're just going to have some patience here. Trying to get this video up and running.
It seems to be buffering.
Okay.
So this is Monica. Peter, Cindy mentioned that you guys were viewing videos together. Could you explain to everyone what was that about? Why were you viewing videos together? What was the purpose for that?
This is Peter speaking. We had the advantage of Cindy had good natural supports at home, and her husband was able to video record Cindy walking in her home, in her backyard, in her neighborhood, crossing streets on her way to the bus stop, and various other locations. And that gave me a really good idea of how well she can use her cane, how well she would stop at an intersection or in a driveway and stop and scan, assess the risk, and then proceed. And the way we did it really was we continued to use Wavelo on my iPad, and then on my Chromebook, I had it set up for Teams so that we could both, we could all see the video, but yet I could still see her and the interpreter. And it turned out to be very successful.
You know, this is Monica. You know, something that we never ever get is, our students, when they come to Helen Keller, they tell us about their home area. Obviously, we can look at a map on Google Earth of the home area, but we never ever get to see them actually traveling in their home environment. So a question to you, Cindy, you had to forge a different kind of partnership with your husband. You were actually asking your husband to be kind of like an assistant to us in mobility. What was it like having him video you traveling in your home environment?
It actually helped me learn a lot about myself. We first tried to explain it to each other verbally, but that got very confusing, and eventually we realized if we just took a video, it would help Peter understand what my home looked like and what my technique looked like. Peter could see the layout of my home, where all the furniture was, that the dog leash was in the way. There were a lot of dangers in my home that I wasn't even aware of. Having my husband video and explain what the normal layout of the house looked like. For instance, where my mailbox is. Sometimes I go to the bus stop, which is across the street, or there's a Starbucks right near my home, which is also across the street. It's a pretty simple route, but it still involves a street crossing. So I asked my husband if he wouldn't mind videoing me, just as I was going about my normal activities. I showed Peter so many videos. He noticed all of these things that I needed to fix. I was making a lot of mistakes, and there were things I needed to improve upon, and I was able to make big improvements because of that. For example, my balance was one thing that needed work. I was also carrying a water bottle in my hand that I wasn't supposed to be, and I never knew that, just things like that.
This is Monica. You know, for all of us who always serve in person, it's so rewarding for us to know that our circle of support has widened. You know, that now we can ask for husbands and wives to help, maybe brothers and sisters to help with capturing data, or maybe other teachers. And also for people that maybe wouldn't normally get to Helen Keller, now we can serve people, you know, in their home area. Now, there probably are some areas that we probably need to stop services that maybe we can't do it virtually. Peter, can you talk about that? You know, with you and Cindy, were there any areas where you were like, we can't go forward with training right now. We have to pause for now.
Well, there was the situation where she goes to Starbucks and she has to cross over a driveway and also through a drive-through because they have a drive-through lane. And there were just a lot of places where the sidewalk disappears and she would have to shoreline the grass while walking in the street. We were able to, you know, problem solve using Google Maps, and that was helpful. But it would have been preferable if I could have been there with Cindy. The only other thing that I think is going to be difficult to do virtually or in a remote fashion, even if a student is demonstrating excellent textbook cane technique, you know, extending the cane, swinging it appropriately, it's still kind of difficult to know exactly how the student is interpreting the information that the cane is providing her with. And that's always going to be kind of tough.
Mm-hmm. And this is Monica. You know, as we wrap up this conversation, Cindy, I'm just going to ask you to reflect on this working relationship with Peter in a virtual format. How did you benefit from Peter's instruction in mobility?
There are 3 things. I've had 3 different mobility trainers in my life. The first 2 were through VR. so I had very limited time with them. During my first experience, I learned about human guide and how my husband can guide me while I use a cane. I didn't learn anything about street crossing, and I didn't do anything independently. The second time I had training, it was for independence, and it was walking around the neighborhood and learning a little bit about how to use the bus, but the training wasn't very in-depth, and there just was not enough information. There also wasn't a lot of education about how I should be using a cane, how I should be adjusting my balance, other components like that. I had many frustrations with signals in the past, and even during the evaluation and the assessment, Peter started teaching me. He asked me so many questions, some of which I was already familiar with, and others I had never experienced before. I really wanted to learn more about trains and subways because I've never ridden them before. I want to be able to visit friends that way, but I didn't know how I would figure out where I am or how to get to them. One of the benefits has also been dealing with the frustration of all this road construction that's been happening near my home. They're widening the roads, which has been a problem. And Peter has really been working with me to figure out what I need. So now they're planning to put in a raised marker to mark my driveway and provide me with a mailbox. This way I can identify the parts of my house a lot easier. I showed Peter what the wider streets will look like, and some areas will not have sidewalks. I was really concerned about my safety on a street without them. We talked about how I could contact the local towns to express my concerns and solve these problems. So Peter has really helped me be able to advocate for myself and ask for what I need. For example, accessible pedestrian signals on street corners, or those painted lines that should be on crosswalks. Some of the streets don't have them. But now I know I can call the town and ask. Peter helped me understand mobility from more perspectives than my other two mobility instructors ever had.
This is Monica. Cindy, I'm so glad that you benefited from the service. And it really sounds like, through most of your comments, you also learned so much more about yourself, and especially all the things that you can do. Lots to look forward to when it comes to advocacy. That now, through your work with Peter, that you can advocate for better things regarding traffic controls and things that help people cross streets, and you know what to do with that process. I just want to end with you, Peter, reflecting on, Cindy's been one of many students that you've provided, instruction virtually. What have been your biggest takeaways as an instructor, about this process?
This is Peter speaking. I think the most important thing is to have a really good plan, and HKNC Mobility Department, I think, developed an excellent assessment process, because as Cindy said, I asked a lot of questions. And these weren't questions that just popped into my head. These were questions on our assessment checklist and our interview checklist. And it kept everything very sequential. And I think it was very comprehensive. I don't think there was anything after completing the interview and the assessment that I didn't know about Cindy. So I think you have to have a good plan going into this.
This is Monica. Absolutely. I couldn't be more grateful for both of your time today. Just reflecting on this process. And I do hope that, one day, Cindy, we get to work with you in person at the Helen Keller National Center on Long Island here in New York. And until then, I really hope that your travels are safe wherever you are. And I look forward to what comes next. Thank you both so much.
This is Monica. We're going to go to Angela as our interpreter. So this is Monica. As we're wrapping up this webinar, there are some key points for everyone to consider before you begin providing O&M services in a remote capacity to those individuals who are deaf-blind. We're going to move to the next slide. It truly is all about communication access for not only the consumer, but also for the instructor. It's essential. We have to consider every single option: vision, audition, tactual needs, and we also need to make sure that we have a solid backup plan. Visual access and auditory access should be optimal. That is the goal we should always work towards. Backdrops and lightings are needed. Mute when needed. Also turn off your camera when it's not needed as well. Breaks are mandatory. Next slide. The essential details for providing services, we all need to reconsider our assessment tools as we did at Helen Keller National Center. We could post my email address. I'd be happy to dialogue with you all on how I redesigned the assessment to meet the virtual needs of our consumers. We need to perform a full case review. It's essential to look at each individual as a whole person and not a part or an etiology. It's important to create a support team with the consumer, gather video data from the consumer if and when you both feel it's appropriate, determine and adhere to hard stops in data collection and instructional expectations. And above all, do not compromise your ethics within our O&M industry. So as we close the future, we've all learned and achieved so much as a company and so much more as a community. Everything is now possible with patience, learning, and feedback. And I hope that one day I will be able to see you all in person. I'll be able to hear your voices. And more importantly, I'll be able to feel the passion in the room. So until we see each other again or meet for the first time, please be safe and good luck with all of your virtual services. Thank you all so much for joining today. I could not be more happy to have the support of Angela and Alana as our interpreters today, as well as Tom providing the textual interpreting for Maricar, and also for our staff interpreters, Aaron and Jamie, who provided the interpretation during Peter and Cindy's session. Thank you all so much. And you can always reach out to us at Helen Keller for any questions regarding mobility services.
Hi, this is Olaya. Monica, do you want to take a few questions?
This is Monica. In the interest of time,
Okay.
Because I do have interpreters on with us,
I got you.
and just respecting everyone's boundaries right now, just because we all have things to do. I would love to take questions. You can email them to me. My email address is monica.godfrey, Godfrey, at HKNC.org. And you can email me anything you want. And if I don't know the answer to your question, I have, as you all know, a plethora of colleagues to call upon. And I will make sure your question gets into the hands of the right person.
Okay, I just put your email address in the chat. And I would love to thank you all for attending, for presenting. This was an amazing presentation, got great feedback in the chat. I'd also really like to thank again our sponsors, CEC DBI-DB, AER BBI, the APH Connect Center, and Orientation and Mobility Specialists Association. We could not have done this without you. We really appreciate everyone attending and taking sharing your expertise, taking the time to share that expertise. We really